have our first confirmed case of COVID-19 in Tennessee.
You've heard it. Coronavirus has made its way to the volunteer state. Health leaders have isolated a 44-year-old man in his home south of Nashville after he tested positive. Right now, he is only showing mild symptoms. He recently traveled to Boston. His family is also quarantined.
Here are the 3 things to know. Health officials have tested 8 people in Tennessee so far. At least 1 in Knox County is still awaiting results. There are no confirmed cases in Knox County, and health leaders say the risk to the public remains low. They are reassuring people tonight. 10
News reporter Cole Sullivan is answering your questions and has more information on how Knox County is preparing. Cole?
Yeah, we asked you for your questions about the virus, and you've sent us several throughout the day. We're answering them as we get them. Knox County health officials say they're reviewing the county's virus plan and have been meeting with leaders. Mayor Glenn Jacob, for example, met with the health department just this afternoon.
The virus is here, but that's no surprise.
Public health was expecting this. We're prepared for this.
Right now, there are no confirmed cases in East Tennessee or Knox County, but several people have been tested.
We actually collect 2 specimens, one from the nose and one from the mouth. Those are put into containers that are appropriate for shipping, shipped to the Tennessee Department of State lab.
It takes up to 48 hours for the tests to come back. Doctors are waiting on results from at least 1 test in Knox County. The risk to most people, they stress, is low.
Right now, the true risk for anybody in the state of Tennessee is either having had direct exposure for more than 6 hours, less than 6 feet with the person who was diagnosed in Middle Tennessee.
Traveling to countries like Italy, China, and South Korea can increase your risk too. Doctors say most cases are not severe.
Most patients with COVID-19 have a mild respiratory illness, including fever, cough, and shortness of breath, and do not require hospitalization.
Still, health department doctors have met with school officials and county leaders to solidify contingency plans. Hospitals, they say, are ready.
All of our hospitals are prepared to handle infectious diseases. They handle the flu every year.
One of the most common questions we've been getting as we've asked you to text us in your questions, what are the symptoms? Dr. Buchanan at the health department says fever, cough, and shortness of breath. And just as with the flu, the health department says washing your hands thoroughly, making sure to rub them together, and covering your mouth when you cough or sneeze with your elbow will help prevent the virus from spreading. Robin, John.
Cole Sullivan on the update. Thank you, Cole. Again, at last check, no confirmed cases tonight of the virus in East Tennessee, but preparations are underway, as Cole explained. The University of Tennessee also announcing it is suspending all outgoing university-related international travel. It says university-related travel in March should be canceled. Last week, the University of Tennessee suspended its spring study abroad program to Italy. It has also canceled trips to China and South Korea. Catholic churches in East Tennessee will only serve communion through consecrated bread instead of bread and wine. Bishop Richard Stitka issued that directive today to all members of the Diocese of Knoxville. School systems in East Tennessee are talking openly about how they'll handle the virus. Anderson, Knox, and Roane County schools are just a few school systems issuing advisories. Each district says it has plans in place and is working to keep schools clean and germ-free.
While the risk remains low, once again, it's low, it's important to know how to talk to your kids without causing unnecessary alarm. The National Association of School Psychologists says parents should be calm and reassuring. What you say and what you do about the coronavirus could increase or decrease your child's anxiety. It says to make sure they know you're available to talk or listen to them. Be honest and give them the facts. Speak to them about how information on the internet might not be correct. Review also with your children the basic hygiene practices like washing your hands. We certainly know there is a lot of misinformation surrounding the coronavirus, especially online. So we want to help answer any questions. You can text the word facts to 865-637-1010 and we will send you resources and fact checks for those claims.
To another